Hi, I'm Dr. Philip McMillan, and I'm here again to keep you updated on the relevant news in relation to COVID-19 and health, and to give you a clinical perspective that, in my mind, hopefully you'll take as an objective view as to what may be happening in different parts of the world. I'm based in the UK, and so I will talk about issues in the UK, and at this point, I'm going to be highlighting Daily Mail article on increased deaths, excess deaths, and morgues being open. And this is the article here. I'll put it on full screen. And it says makeshift morgues built during COVID crisis are being reopened to house dead bodies amid surge in fatalities over the festive period. It was published today in the Mail Online for Health by Joe Davis on the 12th of January 2023. And so I'm going to be taking you through a few of the points that he makes with regards to some of the images about excess deaths and to give you a perspective as to why I think this is relevant. Now, for anyone who has been following my research, I've always said COVID-19 is a viral mediated autoimmune disease. Published two papers on this, and within that context, I'm able to pull back from everything we're seeing and apply that understanding of immune mediated responses, not just from the infection directly, but beyond the infection, to try and anticipate what it could mean at a population level and at a clinical level. And so this is what I've been doing since 2020. I've been able to identify the patterns, and I'm going to be sharing with you just some insights about what that Daily Mail article could be referring to. So the first thing that they have shown here is an image showing the numbers of deaths registered per week in England and Wales. I'll make it full screen, a little bit bigger for you. And so what you can see there, and I'll use my pointer to highlight this, is that red here represents deaths involving COVID-19. Green is deaths not involving COVID-19, and the total is all deaths. Now, where you see this little dotted line, that's the 5-year average. And you can see here, this was in between 2020 and 21. This was just after the pandemic. You see these spikes in red. That represents lots of COVID-19 deaths above the 5-year trend. But what you then notice is that we never quite seem to go below that 5-year trend, except a little bit here. And then in the year 2022, this is 2022, we have stayed above the 5-year average all the way to now. And you can see this spike here. But what's critical is that you're not seeing COVID-19 deaths. That red mark is not there. And this is what seems to be confusing a lot of people. And this is how you have to understand it. The relevance of that is two things. One, the immunity across the population has had an impact, but critically as well, COVID-19 vaccines in the high-risk population would have mitigated some of the severe cases of COVID-19. And in the older age groups, you've seen that we're not seeing as much of the cases with severe COVID-19 coming through hospitals. And so that's where the benefit exists with regards to vaccination. I've always said it should have been targeted to the high risk cohort who we knew 97.4% had comorbidities. That's where you target your vaccination. Now, because we have done it at a population level all the way down, we then have to ask, are we at risk for other things occurring in the low risk cohorts that could impact on mortality? That's really the question. And it's something that needs to be addressed by the scientific community to look carefully at excess deaths to understand what is going on. Currently, the perspective from the paper is that, oh, well, maybe this is all down to flu, because you can see this here is showing the number of flu cases rising rapidly in terms of the red line, in terms of general and acute beds. These are patients who have been hospitalized with flu. But if you notice carefully, they are not actually severely unwell. It's only been a slight rise with regards to critical care beds, And so most of the patients with flu are actually not that sick. That's a good sign. That's something that is something we're happy about rather than being concerned. The other point that the Mail article was pointing about was COVID-19 hospitalizations. And they have used this trend, and you can see it went down in the summer period. So this was winter last year, down in the summer, seems to have gone up again. But again, if you notice, even though hospitalizations with regards to COVID have gone up, the deaths haven't significantly changed. And that's what we have seen on the previous slide, where if you look at the red marks, it remains relatively steady. What we're just seeing is excess mortality. More people are dying than we would expect, but they're not dying of COVID-19 even when hospitalization seems to be increasing. That's what's confusing people. And that's where it's important for me to highlight the understanding that I have about the immune response to infection is very critical in terms of anticipating what can happen at a population level. The other thing that the Daily Mail article looked at was ambulance handover times. And what they're pointing out here is that this has been gradually increasing. So what they're saying is that because we have longer handover times, maybe that's the cause of excess mortality. Well, that's relevant because if ambulances aren't able to get to emergencies as efficiently, then you could have patients who would not normally have died if they got into hospital more quickly getting, well, mortality increasing in a way that we wouldn't anticipate. And so that's something that has to be looked at very carefully. Could that be the cause of some of the excess mortality? Then we look at the weekly admissions to hospital with COVID and flu, and you can see here the trend going up where COVID and flu co-infections, which I've dealt with quite recently. And this is something that's important. This is not normal for us to have both COVID and flu occurring at the same time. As far as I'm concerned, that indicates there is a problem with regards to the interferon response to a viral infection. I've dealt with that at a different time, and I'll not touch on it here. But again, it's important to note that I think that is very relevant in the context of what is happening at a population level. So then the question remains, well, why is there increased deaths? Yes, again, why are we having to open up extra morgues? And this is a trend that we are going to be seeing across the Western world. It's not just in the UK, so it's not a UK thing, it's something that is very important. When I did a post, and this post here was in July 2022, and I said, are you prepared for the COVID-19 tsunami? And this is a picture here of the wave breaking and crashing onto land. And the reason I had done that was because, again, I had looked at what was happening and I could sense based on the research, and this is research that we know with regards to what happened with SARS-CoV when we were trying to find a solution. And I'm being very careful with my words here. There are certain things that occurred with our previous attempts to deal with SARS-CoV from an immune point of view. And it's likely that a number of those patterns are also occurring now, but sadly, you will only know through autopsy studies. If we're not doing autopsy studies, we will not be able to understand what is happening at the moment. And so I'm going to come towards the end of this discussion, and I'll not mention too much about Andrew Bridgen. He's an MP in the UK who spoke in Parliament about concerns about the impact of mRNA vaccines on the population. He has now had his whip removed because he had said something comparing it to the Holocaust. He got into trouble about that. And I think that what we have to be careful about is that whilst he may have said something inappropriate, we still need to address what he has said. And here is the image that I think is most important. I keep referring to it. This is the Euromomo chart, and it's looking at excess mortality in the age group of 15 to 44 years old. And what you can see here, this is a standard year 2019. I think 2018 was probably a little bit higher, but that's excess deaths. in the 15 to 44-year group. In 2020, it increased, of course, because of COVID-19, but both in 2021 and in 2022, the excess deaths in this young group has remained elevated. This was a point that I made since last year, January. I said this was a very important flag that had to be investigated to find out exactly what was the cause. Because I predicted at that point, if we didn't clarify that and the trend continued, it is no surprise that more and more people are linking it with regards to what could be happening in terms of vaccination. It's not surprising. And when I look at the comments in the Daily Mail here, surge in fatalities over Christmas, I'll just make it big screen for you. Typical mainstream media news cannot report the truth. Facts are that there were over 1,600 excess deaths, which are heart related. Why is it not being investigated? And people are asking the question about clot related events that are occurring, died suddenly, which was something that was on. The public is asking the question. And I suspect that what happened with the MP raising this issue in Parliament, he was asking a question that much of the public is asking. And if it is not answered adequately with thorough studies, this could have a long-term impact on the trust of the population in the context of health. That's my warning in terms of public health. I think that we need to address this. Again, I'll share this picture, the Euromomograph. Last year, I saw the same trend. I raised the flag on it. It is still elevated in 2022. It needs to be understood as exactly why it's occurring. That group shouldn't be dying. Older age groups you can argue about, not 15 to 44 years old. Something isn't right, and we need to clarify what that is and make sure that we have addressed all the issues that need to be looked at. Thank you for joining me here today, and as usual, join me on Substack if you want other independent research and thoughts in the future. Have a great evening.